Dear participants, good morning, whatever you have. Good afternoon, good evening. Let's begin our today's meeting. The We're getting connected. We are very glad to have you here. I'd like to say that today the meeting we have in two different languages, especially in English. And in order to choose the convenient language, please find a little globe button at the bottom. You can choose between Russian and English, and then you'll be able to participate in the language that is more convenient to you. My name is Roman Sklotsky. I'm the managing director of PASTE, Palliative Care Education Foundation, and today we have gathered to introduce to you our public annual report. This is the report for the previous financial year. We are a British foundation, that's why we follow the British calendar, and our accounting year is from April 2023 to March 2024. And of course, we will cover 2024 because there were a lot of other activities, interesting activities happening during this period of time that we missed. For us, this is very, very important because today the absolute majority of the participants are the participants of our PASTE Foundation. We've been working for you. We are accountable to you, first and foremost. That's why it's so important for us to tell about what we're going to do to you. For those who don't know who we are PASTE Foundation, charity foundation registered in the UK. PASTE Foundation was founded in 2017, and we support the professionals of palliative care in the Central Asian countries, the Caucasus countries, Eastern Europe, and the Baltic countries through experience exchange and professional educational support. Now, we'll make sure to share a link to our website, and you will be able to get to know all of our publications. You will also be able to see the little info about our speakers. So if you're interested, you can give it a look. What is more? A few more housekeeping for you to know how to get in touch with us. At the bottom of the main page of our website, there is a digest, a newsletter, which is how you can get all sorts of news and information about our events. What is more? We have a closed Telegram channel for the professionals of palliative care from the countries of presence for PASTE, Central Asia, the Caucasus, Eastern Europe, and Baltic countries. You can also fill out the form. The link will be in the chat, and you will be able to have access to our closed Telegram community. I can see we have more and more participants. I'd like to once again remind you that we have two languages, English and Russian, and in order to choose the convenient language, you can find the globe button at the bottom of the Zoom panel and choose Russian or English, whatever is more convenient. What is going to happen? First and foremost, we're going to introduce our report, tell you about what has been happening throughout our year, and not only about us, we're going to speak a little bit about the history of PASTE. After that, we are going to hear some interesting stories, hopefully. The stories of the people that have become a part of those stories thanks to PASTE. And we'll be able to have a look at the future, check the plans that we of course have, but we would like to align with you here because again, we work first and foremost for you. This is the agenda for today. The max time we'll be together is about 2 hours, and so far, I'd like to say that we have our two friends working with us, simultaneous interpreters, Chris Rockfield and Anna Akmaeva. Thank you very much for being with us today. Again, as always, it's a pleasure to work with you. And today I'm the only moderator, the only speaking head, as you can see. We also have a fantastic friend and colleague that I'd like to introduce. This is Dr. Piret Paal, and we're so happy to have you today, Director of Palliative Care and a researcher in the University of Tartu in Estonia. And also Dr. Paal is the leader of the initiative called COST. This is the European Program for Collaboration in Research and Technology. And in this initiative, there is a project called Holia, and Dr. Piret will be able to say a few words about that as well. But this is definitely helping the development of standards and professional education palliative care. And today we have a fantastic constellation of our colleagues, the speakers who will be able to help us make this event more meaningful. And I'd like to start by saying hi to Yulia from Kazakhstan, Yulia Streletskaya, who is an anesthesiologist and reanimatologist from Kazakhstan. And I'm also happy to introduce Gulnara Kunirova, also from Kazakhstan, the main specialist in the Ministry of Healthcare in Kazakhstan Association of Palliative Care, and the executive director of the charity foundation Together Against Cancer. Hi, Gulnara. We also have Irakli Vetsko from Georgia, heading the Georgian Child Hospice. Appreciate your presence, Irakli. Thank you so very much for being here. We also have colleagues from Armenia, Narine Mavsisyan, an anesthesiologist and the tutor at Yerevan State University, the professional in palliative care, and an international leader of an initiative called Palliative Care Leadership Development Initiative. Hello, Narine. And together with Narine, we have Anush, a rehabilitologist, the head of Child Palliative Care Department in a clinical center. Hi, Anush. I can also see our colleagues from Latvia. Hello, Yulia. Really nice to see you. Yulia Sirule-Galuza in Latvia is in charge of child palliative care. And also we have colleagues from Uzbekistan, but I don't know yet, unfortunately, these people, but at least online we'll be able to see them. An oncologist, the Secretary General, the oncologist movement in Uzbekistan, and the leader of Palliative Care Development Initiative in Uzbekistan. We are glad to see all of you. I also see we also have Milana Turgunalieva from Kyrgyzstan. She's a co-chair of Hospice and Palliative Care Foundation in Kyrgyzstan. We are glad to see all of you. Dear colleagues, we have a chat, and if we have an opportunity, we'll try to make the meeting as interactive as possible. Please leave your comments, images, links, anything you wish. We'll try to make sure we react as quickly as possible in the chat. We'll try to make sure everything is solved as quickly as possible. Hopefully there will be no problems whatsoever. But before we begin, I'd like to make sure I have an opportunity to say a few words about Dr. Paal. We've had a chance to interact with Dr. Paal on two fantastic, interesting projects. One is called the Art Initiative, which is aimed at improving palliative care, and PACE is a part of this initiative, and it's as an active participant of this initiative. And Piret, apart from Kodia, has been also a tutor at our summer school in Armenia, in Yerevan, which was organized in June this year. And Piret has shared a lot of her expertise, and today it's especially valuable to have her with us. If it's okay, Piret, is that all right to ask you to say a few words? Maybe you want to just, inspire us, say a few words about how you saw our participants in person. Maybe you want to wish something to the participants?
Good morning, everyone. And now you can change the language if you wish, but even though in my heart and my head, I would like to answer you in Russian, I think it's better if I stick to English. So yes, it is scary how fast time goes, and it is such a delight to see what kind of power PACE has actually gained in these years, because also for this organization, PACE, when it was born created. It started off very strong, and I kind of monitored the birth of this as a very valuable addition to the European Association for Palliative Care, which is very much focused on UK, for example, and the developments in many countries where the investment into palliative care is much stronger than in the countries where we operate. And then I always felt that attending those EAPC meetings might be somehow even offensive for some of the countries that don't have so many investments and resources at their disposal. And therefore, I have been like championing also the development of the BASED. And I have also seen difficulties in your growth, which is, I think, also a normal thing. But now I think you have reached some stability and gained some ground, and you are really starting to make impact. And even though impact is such a buzzword these days, and everything has to be impactful, I think it's for this group of people who come together under the umbrella of BASED, and it's just a very convenient and lovely atmosphere to get this kind of shoulder tapping from each other, that we are doing such a precious work, and that what we do, each of you, is just plenty and enough. And then also this kind of motivating and inspiring each other in a different on a different level than maybe a very majestic British very well funded thing might seem like, okay, that's fine, but we never can achieve that at this point of time. So palliative care and palliative care development has been over the years like taking very, very small steps forward. And I think that this kind of collectively taking those steps is very valuable. And that's why I am just really looking forward, also after our wonderful meeting in Armenia, that how this will evolve, and at what point you are with your organizations and countries, and what are also your next steps. Because today we are here to kind of look back, but also always look forward, So yes, thank you for this opportunity, and let's learn from each other and keep supporting each other. Thank you, Roman, also for inviting me to be part of this.
Well, thank you, Piret, for being with us today, and not only for your kind words. And also, of course, we'll be talking today of what you just talked about, mutual support, about the collaboration of what we expect in the future. On the one hand, it's exciting, but on the other hand, it's a bit stressful. Because we are all, smart, professional, committed, independent professionals. But at the same time, there are circumstances that sometimes look better than us, but let's try to see what we can do. Before we proceed to our annual report, I'd like to introduce everyone our team, which of course has been a team of enthusiasts, thanks to which you can see the results, and you will see the results of our annual report. This is definitely their input. I'd like to go name by name. Anastasia Gulyavina, Strategic Development Director, Irina Zhukova, our Program Director, Inna Babina, our Communications Director, Ksenia Pominova, our Project Office Director, Felix Bakirisa, our Project Office Manager, Ekaterina Nazarenko is our designer, and Uliana Pavlovska, our writer and translator, a content creator, and many other roles plays as well. And of course, I'd like to thank our trustees, Nuta Federmeister and Polsky. Now, let's have a look at our annual report. What was it, and what can be done, what's done already, what kind of paths we've gone through, and let's look at the history of PACE a little bit from the moment we have been. Now let's see the report, and I'd like to forward both languages for the chat.
So thanks to Katya Nazarenko, it has a very nice design. That's why we decided to show the report itself to you, not just in the format of slides, because we would also like to make it visually pleasant. So I would like to mention, thanks to Katya Nazarenko, this year we got our slogan. I now highlighted it, and in English, it's making every moment matter. So this is something that indeed inspires us. And this is something that is really nice. And now Anush Sargsyan has joined us. Colleagues remind me of this. Anush, very welcome. We actually already introduced you before you joined. Thank you for being with us today. So our slogan is making every moment matter. And indeed, it has significant meaning for us because everything that we are doing is about moments and respect for a person as well as for the respect for the human life. We all should have the right to live in dignity. And in many cases, this slogan actually reflect the vision that we already got before. We also using some business terms here, and we use the term vision. So we would like to offer everybody who needs palliative care the opportunity to get it. It's about a holistic approach, multifaceted one, and it's not only about these people themselves, but it's also about their families. And we as PACE, we are trying to move towards it. We invest in professionals and we support our colleagues in the countries where we are present in the Central Asia, in Caucasus, in the Eastern Europe, and in the Baltic countries. And we believe that people can indeed change the systems, and they can make some breakthroughs to improve the quality of palliative care where they operate. Here on this slide, you can see some figures. I believe that those are very important. This is our expert assessment. It's a disclaimer. Why? Because as Piret said, quite often there is no understanding about what is happening in our countries from the palliative care point of view, especially if we talk about some helicopter view, right, like the view from the very top. So this is the area that is under researched, especially if we compare countries where we are present to Europe or North America. Obviously, here we have less palliative care, but we calculated this in any respect, in any case, because we need to also understand the scale of the problem. And well, about 2,250,000 adults need palliative care in the region where we operate, and about 100,000 children need it. And of course, very few of them get this. Only 1/3 of them receive the palliative care that they need. So there is a huge room for development, and this is our scope of work for the future. And now I'd like to talk about our strategic goals, about what we are doing. As Piret said, we believe it's very important to build connections and partnerships between people, institutions, and organizations. We see huge potential here, and our school in Armenia showed that these initiatives can bring results very fast. And we try to identify the best international practices, including problems connected to language barriers that exist in our countries. And we invest in people, in leaders, and not only in those leaders that are capable of adding to the palliative care system development, but others as well. So here you can see the countries in the right side of the slide, the countries where we worked in different formats. So we are quite diverse. Our countries are quite also diverse when it comes to the languages, and that's why our working languages Russian and English, and today we're also offering you this webinar in both languages, Russian and English. So, we are talking about the British financial year, right? Because we are a UK-based organization. And here you can see the figures starting from April 2023 till March 2024. So we calculated that last year, 283 specialists took part in our educational initiatives from 32 countries. This is actually more countries than where we are present. So more people from more countries communicated with us and cooperated. And we also tried to analyze what PASTE did over the whole history of its existence over more than 7 years. And well, we calculated that 750 professionals got trained with our help. And on the second page, you can see the partners that are very important for us. Those are the associations of palliative and hospice care that are also represented today. So you can see this list, and we continue to actively develop this partnership. It's very important for us to cooperate with this infrastructure place in our regions. And dear colleagues, thank you very much for being open to cooperation with us. At the same time, it's quite important for us to integrate in global projects. For example, Code Ya, the project that I already mentioned, or also International Collaborative in Best Care for Dying Person. This is the initiative that we also joined as a member last year. Or, for example, e-hospice initiative. Maybe you know about this international portal. This is a news portal for professionals in the field of palliative care. And well, we also started to supply the information to e-hospice portal about our countries, countries where we work. It's very important to close the gaps on the map, and it's very important for us to be present at such platforms as e-hospice. It's a very important goal for us. And here you can see a very diverse group of our experts, partners, very prominent people. There are a lot of these people on this map, so I won't now mention once again everybody, but those are the professionals with whom we cooperate and communicate. But it's very important and valuable for us because, well, each and every expert has its own, his or her own field of expertise, and we're very happy that these experts support our initiatives. So thank you very much, dear colleagues, and we just wanted to visualize it on this map, just to reflect the scope of experts that support us and help us to develop the palliative care in the based present countries. So it's been 7 years since we were founded, and of course we need to mention our trustees. It's Newta Federmesser. She's a founder of Vera Charitable Foundation and the director of the Moscow Palliative Care Center up until 2024. She offered significant help to us, and our second trustee is Dmitry Yampolsky, philanthropist, entrepreneur, and attorney. He's a co-founder of the Visit Health private healthcare clinic in London, and also Friends Foundation. It helps the charitable organizations to become sustainable and independent. And of course, I need to mention Dr. Robert Twycross because he was one of the ideologists and one of the co-founders of PASTE because he understood the importance of palliative care development in the countries of our present. He is a world-known guru in this field, and if it wasn't for him, maybe not all of what we've done would have happened. As we know, he passed away this year, but his heritage and legacy will be with us for many years ahead. So, Dr. Twycross, we will always believe you, and thank you very much for your input to the palliative care development. Now we move on, and well, we gave you some history, but I would also like to talk about people that worked with PACE during different periods of time. So some of them joined, then left. We also had volunteers that still work with us, and I would like to thank everybody, especially our volunteers. It's quite a huge group of people that include translators, designers, technical professionals, and many other professions. Thank you very much for being with us. It's our common way forward. Here we try to, um, think about the names of the milestones that has gone through. So the first milestone is called here "The Story Begins." Indeed, that was the time when PACE was building and formulating its position. We tried to understand our mission, how we can help, how we can be useful, what is the demand in the countries of our present. And here you can see some first initiatives and first steps of ours. For example, we took part in the session in a EPC conference in Berlin, or also, for example, we started a project on palliative care in Georgia together with the St. Christopher's Hospice. And we also worked in Kyrgyzstan during those years, and we can later on read the description in more details. Then the next step and stage for us is called towards a systemic approach. So this is when we formulated already our own mission, we experimented, and it was time for us to be more systemic, to be more thought over or thought through here. But then COVID came and it undermined our plans in many respects. And one of the very important events at that time was a big meeting with participants from Azerbaijan, Kazakhstan, Uzbekistan, Moldova, Russia, Ukraine, Uzbekistan. And that was a meeting on how to respond to COVID-19. And so that actually was the beginning of our shift to the online, even though we continued some offline initiatives. Talking about online, during that time, participants from our countries, thanks to PACE scholarships, could participate in an online congress of EPC, and also, we had some offline initiatives. For example, training for professionals from Georgia. It was organized in London in St. Christopher's Hospice. And we are moving on closer to our current times. And here we can see the period 2022-23, and we call this period New Horizons. Why are those new horizons? Well, because we launched a very important platform for us. It's called PACE Network, and many of you are active participants and users of this platform. You share comments. We open new horizons like this. And also during this period, we joined the project, which is called Code Ya, and this also opened some new horizons and very interesting opportunities for us. And now we are moving closer to the year that has already passed. We didn't give this period any name, so if you have any ideas, dear colleagues, how we can call the period 2023-24, please share your ideas. Maybe we'll even redraft our annual report, because that would be very nice to give this period a nice name. So here you can only see figures, but a lot of actually backing up these figures. So we had 10 webinars during this reporting period, and I'm sure that now more than 847 people viewed those webinars. We also published 10 monthly digests. We've become partners of eHospice, and at the end of the last year, we've published a common shared digest on very important news and research in the field of palliative care. And here on this page, you can see all our webinars and the titles of these webinars. So when you open our annual report, you can also just click on the titles of these webinars, and you will be transferred to the webinar video page. And we started to travel more. We started to cooperate with colleagues physically more, from colleagues in the countries where we are present. Some of our conferences were online in Latvia, for example, we discussed about difficult and challenging topics in palliative care. And also here you can see our colleagues Ira, Ina, and Gulnara. And we went to Kazakhstan to see our colleagues there. We met our colleagues in Armenia. We met our colleagues in Uzbekistan and in Georgia. And we even went to Austria. And there we took part in the meeting of the Code Yap international project. So the year was very fruitful for us, but this is not the end, because actually this year we officially launched our grant program. Yes, it's quite small now still, but we hope to develop it further. And we got 32 applications for this grant problem. So this is a grant problem program of professional mobility. We got 32 applications from 8 countries, and Yulia Streletskaya from Kazakhstan was the grant winner, and she used this grant to take part in the 6th International Congress on Pediatric Palliative Care in Italy. And of course, we continued to develop our partnerships that I already mentioned. I won't repeat myself here again. And so what's also quite important here is to mention the following. We are still quite a small foundation, and we are supported to a large extent by volunteers. Here you can see some budget of ours, our income, expenses, and pro bono services. And this is also due to the work of volunteers. We really try to become better than we are even now. So that was quite an interesting year for us, and the history was also quite interesting. And here you can see again our slogan, making every moment matter. It indeed inspires us. And here you can also see the links to all our social media and resources that we use. Actually, this is also quite an important achievement of PASTE, because, well, as we believe, we learned how to pack information on palliative care, the knowledge in palliative care, in some contemporary formats that are easier to comprehend and that make us more clear. And I believe that it's also important to mention the following. A very important event that happened this year, it happened in Armenia. It is not in the reporting year that I presented to you, because it was after March 2024, but that was a summer school in Armenia. So first, dear colleagues from Armenia, thank you very much for your hospitality and for helping us to organize all this. Thank you for your enthusiasm. We met in Armenia from 24th through 26th of June in Armenia. And many of you who joined us today took part in the school. We got 52 applications from 7 countries, and we selected 40 members and participants from 6 countries. So those were quite busy days, site visits, lectures, webinars, workshops, some informal communication as well. But major topics that we covered during the school is philosophy of palliative care, symptomatic pain management and relief, and also the organization of mobile services work in palliative care. We do hope that next year we'll be able to organize something similar. So I would rather stop here, and I would like to give the floor to our distinguished speakers, because I think that's the most interesting is what's happening with you. And as I announced, I would like to give the floor to Yulia Streletskaya. She'll share a life story. She went to Congress in Italy thanks to PASTE grant. We followed your progress, but not everybody knows, Yulia, how it was happening. So if you could give us some details on this, how it all went in Italy, that would be very nice and interesting for everybody.
Hi, everyone. First and foremost, I'd like to say thank you very much for this opportunity to take part in this grant competition. And here I should be fair and say that there are so many people who helped me understand what PACE is and learn about this during my project. The grant application wasn't so complicated because the conditions were clearly explained and they were very simple. and by having some experience in the past, that was not challenging in general.
Почему я именно
Why
выбрала
did I choose
память
these
Конгресс?
keywords
Потому как
specifically?
с учетом сроков
Considering the
работы
application
заявки, понимая, что
terms,
могут быть различные
there might be some red
бюрократические
tape
моменты, когда в всех
elements
грантовых
as in
заявках,
any
это
grant
нормальная абсолютно
applications.
история. Я
I
выбирала
was
то
choosing the
мероприятие, которое
event
будет
that would
максимально
be
интересным,
uh,
полезным как
as
человеку,
helpful as
который
possible, as
защитником
impactful as
работает
possible. For
в
me, as the
детской
person who works
паллиативной
with child
помощи,
palliative care,
так
this
и
was the most relevant one.
максимально
And
отсрочить
also was
от
the
времени
furthest
подачи
standing away
заявки.
from the time when I
Заполнить
applied for this
максимально
grant.
полезный материал, максимально
And
дата
so
проведения
the
от
dates
даты
were not
подачи
coinciding, and that was
заявки.
helpful.
Вот, поэтому
So
из
for
всех
the events, I
мероприятий
chose
выбрала
this
именно
specific
Конгресс.
Congress. The
Конгресс
Congress was
действительно
really amazing.
потрясающий,
It was
интересный,
interesting,
было очень
and
много
there were so many
спикеров,
fantastic
и
speakers. And
больше
what
всего
was
мне
most
понравилось то, что
impressive
все они
is
достаточно
what
открыты,
everyone was very
контактны, и
open
можно было
and
обменяться какими-то
approachable.
данными,
We
там,
could easily
почтой,
exchange contact
телефонами для
for further
дальнейшей
contact,
связи.
for further
Это тоже
communication.
очень
That was
порадовало.
also
Это такая
very,
копилочка ресурсов на
resourceful for the
будущее.
future. That was my little
Я периодически
um,
сидела пока
piggy
на
bank for the future.
докладах, Ире отсылала там фотки.
And
А вот смотри, здесь вот что было.
we had so
Здесь
much of an
вот сказали.
exchange of
Просто
opinions with my
побыстренько
colleagues. I was sharing a
знания.
lot of pictures of
Это
different
интересно, потому
slides,
что на мероприятиях такого
people. It was
формата
the first time I
первый раз.
participated in such an event,
И
honestly. I was very excited.
достаточно была впечатлена
I
уровнем
was
организации,
impressed by the
уровнем
level of
докладов. И
reports
интересная
and the level of
тематика,
organization.
она
The topics
разнообразная.
were
И
quite
даже
diverse,
несмотря на
but
то, что тема
also
все-таки
considering
называлась
that the
как бы перспективы горизонт
it
и
was called the
высокие
perspectives and
технологии,
horizons of my track,
масляная тема, но
but still
все-таки вот именно таким, наверное,
the
акцентным
good
моментом была
accent
как
was
раз-таки важность
the importance
грамотной
of correct
коммуникации. И
communication.
я для
So
себя
for
это
me,
поняла,
this
что,
was
наверное, это
critical.
самый основной
And I
ключевой
think
ключик в
for
паллиативной
palliative care in
деятельности.
general, this is a great key key
Ну,
to
вот
success.
так вот прошла
So this
моя
was my
поездка
trip to
замечательная.
Italy.
Это
I
было
was really
интересно,
curious,
познавательно,
very
это
exciting,
было с большим
with a lot of
количеством впечатлений.
impressions, so, of
И
course.
еще
And
раз
I
позвольте
forgot to
сказать, я
say,
все-таки даже со своим
maybe
языком
my English
немножко
wasn't perfect, but
осмелилась
still I
подать
applied
заявку, отправить свой
and
доклад.
also
И
sent an abstract.
благодаря
And thanks to
коллегам
my
из
colleagues from
Узбекистана они тоже
Uzbekistan, they
очень
helped
помогли
me
вместе со
and they
мной
managed to
рассказать мой постер
present
на
my
этой сессии.
poster.
Это тоже было как
To
бы
me,
очень
this was
важно
also
показать, что
important
у
to
нас
show that
настоящее
in my
что-то
country we
есть,
also have
что
something, that we're
можно
working
сделать.
on it. Thank you, Yulia. We're so happy for you the moment that the abstract was accepted and that you're going to present. You're not going to be just a participant, but also a contributor. There were also some interesting topics that you shared with Irina and myself. It was something like artificial intelligence in palliative care or something, very unusual topics that were unusual to
Да,
us.
да.
Yes,
Искусственный интеллект
the AI
и
and
тематика
high tech
высоких
as well.
технологий, использование, например,
For
технологий НЛО,
example,
да, то есть
different
паллиативной
technologies that can be
помощи. Это
used
было
in
очень, ну,
palliative
конечно,
care.
для нас
For
это было
us,
просто
this is
что-то
something out
запредельное
of
на
this
сегодняшний
world.
день, и это очень
This was very
впечатлило.
impressive.
Спикер, который
The
рассказывал
speaker who
о
told us,
то есть человек вообще
the
не из
person
мира
who was
медицины,
totally out
это
of this medical world,
архитектор,
he was an
который
architect,
рассказывал
told
про
about
то, как
how we
можно
can improve the
улучшить
life
жизнь
of
детей,
children
например, создавая какие-то
by
различные штуки,
creating
вручную
designers
взятые для того,
activities
чтобы
and
детям было
by
комфортнее
creating
передвигаться
special
на
space
различных
um,
колясках и различных средствах
design so
транспортировки и
that
всем
children
прочем.
would feel
Да, и очень
comfortable when they
интересный
move
доклад как
around,
раз-таки
etc.
о дистанционной коммуникации,
Speaking of
который,
communications, by the way,
наверное, был бы идеальной
I
моделью для тех
think
стран, где пока
this was
восстановить какую-то
critical
качественную
for
паллиативную
the
помощь в
countries that
местах
still
невозможно. То
suffer
есть
from
именно финансового
underfunding for palliative
зарабатывания
care.
неправильной
So
организации.
communication, it can be a key for such countries. Yes, thank you, Yulia. Thank you very much. Maybe you have any questions to Yulia or to myself? We are moving forward, and if you want to comment on something or share right now, you can also leave that in the chat, react, don't be shy. While you're thinking, I'd like to once again share with you also quote a few words from Yulia. This happened in 2024. Yulia Sirule-Galuza from Latvia. Latvian palliative care turned 26, and there was a 25th year anniversary as well. So soon we're going to have an interview on our website. Just like with Yulia Streletskaya, we're going to publish that on a website. But my question is as follows. I remember that you went to Tbilisi recently and you've seen a hospice there. Can you say a few words about that? Why was it important and interesting, and what did it give? Yes, thank you for this opportunity to take part, and thank you for um, unite for uniting the ones who help in palliative care. I think people who work in this area can discuss practical questions with each other and feel the support of those who work in this field. Speaking of Georgia and going to Georgia and seeing how people work there, I thought about that for quite some time. Uh, when I studied in Habsburg, I remember that I had a colleague from Georgia, and my husband works in palliative care as well. And when we decided that we can go to Georgia, I thought it would be nice to check the previous contacts, and I talked to Irakli. He gave me permission to open the doors and see what is going on there inside. We have so many similarities. Of course, there are some differences, but each of these contacts gives us a chance to get better horizons to make further decisions. We understand what we can take from these experiences. We can say, oh, that's good that you have selected this place and chosen the other path and it wasn't successful. And I think this can really improve the quality of services in our country. Then we become not only colleagues, but a little bit friends who can help each other, who can support each other better, and, in general, take part in the research together. And the work becomes better and more convenient. So thank you very much for the digests as well. We also have a journal club once a month, and now I inform all the colleagues that I see the article that I see in the digest. We speak about the things that are relevant to us, but we also speak about the relevant news, magazine articles, journal articles. For certain scientific discoveries to be applicable, we need not to just point them out, but we also need to discuss them in a living conversation. Yes, thank you so much, Yulia. Can I ask you a quick question to both Yulias? I understand that we didn't have too much time, but what has changed in your work, Yulia Streletskaya, in your case after the trip to Italy, and Yulia for you after the trip to Tbilisi? Maybe some small things that you started doing differently, or you didn't really introduce anything into your work after the trips? Well, it's really been a short time, but there were certain ideas in terms of how we can develop the project.
Так как у меня все-таки поле деятельности очень
Since my
узкоспециальное, это
activity is
неонатальные пациенты,
very niche, very
то
narrow,
сейчас идет поиск
now we are searching
каких-то
for
дополнительных
additional
средств
funding
и
and maybe
организаций,
some
которые могли
partnership
бы
organizations
развивать в паллиативную помощь
that could
более
help us
широкий
develop
замес,
palliative care in
но
general,
пока что на базе
maybe
каких-то
based on
научных
some academic
исследований.
projects or
Но тем не
something.
менее, чтобы это
But for
можно
this
было
help to
доступно
be
большему
available
количеству
to
пациентов
a
и
bigger number of patients and to participate better. Yes, thank you, Claire. How about you, Yulia? It's hard to say how much it's Georgia only, but what I was impressed is how they work without the support of the government. We rely very much on the work of the government, the support of the government. Right now, we are in such a stage when we are organizing Latvian Alliance of Palliative Care, and for me, it's becoming easier to think about this because we can search for some alternative opportunities, not to be fully connected to the government by funding, for example, because it definitely ties your hands and you can develop in the way you want. Oh, yes, this is a very critical, very interesting question. Maybe now we can move on to our next point on the agenda, which is about speaking on the future. I think this is a great bridge that you're making. We have a lot of ideas on how to help you in the future. We are definitely a small foundation right now, and a lot depends on the resources. Of course, the question is how much we can accumulate, but we are very happy to hear those big plans of yours that are there for the next year. And in order to moderate everyone, I'd like to move to ask Dr. Piret Paal, please move on. Maybe you haven't read the message. Yakhyo from Uzbekistan is going to move very shortly, so maybe you can start with him.
Thank you, Roman. Just once more, it has been like your summary again showed also, and I think in you and your team, you really need to hug each other, even if it's just a virtual hug for this this new power in this based movement, because just like this. Last years since you joined, and it has really, it has become very, very visible, and it's very clear what its targets and goals are. So virtual hug to all of you, and thank you for doing this work and bringing people together, because you know me, and I always say that it's just learning from each other, and this is another opportunity for that. And we do experience the linguistic barrier, and you have removed this barrier so that also people who work in palliative care, and perhaps like Yulia said, you need Yulia, our grant recipient, that you need support even from other countries, you know, to make your message heard in an international conference that actually also only represents people from Western Europe. So I think that world is bigger and it's richer if we can make our voice heard amongst us, but also carry the message out. And you said also that what would be the goals, or you asked what would be the goals for the future. I think that we could think about, there is a Polish journal, but it's called Palliative Medicine in Practice. But we would need more this kind of publishing outlets, so that we could publish research on a high level. And for that, obviously, we need to work together to achieve funds, as you said as well, to do the research, because it will be difficult to kind of get your foot between the doors to publish in palliative medicine or BMC palliative care first. But but it is of course possible if you collaborate and work with authors who have established themselves already. But it also needs really research. And when I was in Armenia, I heard from quite many, and this is what Julia in Latvia is also doing, introducing scientific papers so that people get inspired, and besides the clinical work, we'll do also research, because we do have evidence, but we have from other contexts, and we need evidence from our context to understand what are our next steps. And this is exactly why we are now today here. And I am really, I have to now cheat a little bit. I promised Roman that I will pronounce names as Urmas Ott formerly did in this in his shows, but now Yakhyo Ziyaev from Uzbekistan. I am really glad that you have joined us today. You are Secretary General of the Association of Oncologists in Uzbekistan, and oncologists are proud when it comes to palliative care. I'm really interested of what is it that draws you to palliative care, and what are your aspirations for the future? Please, the floor is yours.
Thank you very much, Piret. Actually, Dr. Jarosz from Poland was my first teacher in palliative care. So I visited Poland, and I was very impressed by St. Christopher's Hospice, which is located in Poland. Now, with your allowance, I would switch my language to Russian.
Because we do have translation anyway, it's interpretation to the interpreters. So thank you so much for this opportunity to talk to you, dear colleague. And Roman, I wasn't able to connect on time when you introduced me. I'm sorry, so virtual hello to you. Well, Uzbekistan right now is at a turning point. So we have been in this point for about 3 years already. So we have some small achievements, at least in the first hospice. Together with my friend and colleague Rustam, has participated in the conference essay. And next year, we'll complete the construction of the central hospice in Tashkent. This will be a big meta center. This is the plan for the future.
So first, we'll be busy opening our methodological center, as I said, and I hope that I'll be able to send you invitations in advance for the opening ceremony. We would really like to welcome you in Uzbekistan, in Tashkent, for this, not only as guests, but also as experts who are ready to train our professionals in the field of palliative hospice care, because we would really like to take off well with our center in Tashkent. And so as for the next year, again, we have a lot of plans. We would like to organize the Association of Palliative and Hospice Care in Uzbekistan. We've already created a department for training in the field of palliative care, and we will also move this department to our main building when this main building is ready. And we'll continue to work on developing competences, in other words, on capacity building. So we would like to enable our colleagues to be capable of using all the instruments and tools in the palliative hospice care. Because you know that, well, 0.4 milligrams of morphine is consumed per capita in Uzbekistan, and so it's 100 less times than the world figures and numbers. So I hope that through education and through concerted efforts, we'll be able to close this gap when it comes to our knowledge in our country. And we would really like to offer people in Uzbekistan that need palliative care this help and to alleviate their suffering. And so thank you very much. And if you have any questions.
Thank you very much. And it's really nice to see that even if it's a children's hospice, it opens and paves the way also for an organization of palliative care. And as long as others are maybe writing their questions, I would like to ask if this organization is only for physicians or is it also for other professionals?
No, it's not only for physicians. It's do you mean the association?
Yes, because you said that you are planning to make an
Yes.
association or an organization, because I think it's very important to have this kind of representative body, and it is challenging. I know that, for example, in Czech Republic, they kind of wanted to do interprofessional organization, but like it's strategically sometimes better to do it for physicians only because they have, you know, this kind of more stronger representative in representation in the country, for example. So how are you dealing with that?
No, initially we are planning not to limit people by their professions, because we have psychologists and social workers working, and nurses, of course, working side by side with us. So to my perception, we will include them all into the association so that we will have a bigger umbrella.
All right, very nice to hear that, and also congratulations that about the new hospice then that will open soon, as well as that you will start to teach people. And I am sure that everybody here is like ready to come and visit and teach if they can something, but at the same time also learn from you. So yeah, thank you very much. I don't see any
Thank you.
questions, or is there a question? No, there is just the invitation to go to Poland as well for you. So you see, that's why we have those meetings, so that we can travel around and see the new foundation oncology hospice. Then, yeah, great. Thank you very
Thank you.
much.
Thank you.
So. Yes, bye. And it's also nice to see always the smiling faces when people speak about palliative care, because the perception outside is always that we deal with very tough things and we are sad most of the time. Yes. So, no, we are not, of course. Now we move from Uzbekistan to Georgia. I am glad to introduce another colleague, Irakli Vetsko, who is speaking to us about some developments in Georgia. Georgia was the first country for PASTE, literally, where they started like to invest their knowledge. And I have been very jealous of some work that I have been reading also from Georgia, because once I read an article in Journal of Palliative Care, and I thought that where you get so wise patients, because I was amazed by the life wisdom of the patients when they discussed end of life. And I was like, oh, I've never read such amazing responses from patients. But that's, I think that is very characteristic to our hemisphere, where people have had access to very good education, to be frank. And so learning from Georgia and Irakli, the floor is yours. You have to put your microphone on, and then it's easier to listen to.
Thank you. Good afternoon, everybody. Thank you so much for this opportunity. First of all, let me express our deepest gratitude from the entire team of Firefly World to be part of the PASTE activities. We had ample opportunity to participate in different webinars and other meetings throughout the year, which then we share among the rest of the colleagues who didn't have the opportunity. And we do really appreciate this platform, which is great for sharing experience and gaining new knowledge. Considering today's current situation here, probably you guys are at least a little bit following on the international news. Honestly, it is hard for me to make bigger plans for the future, but we do have certain actions in mind that we would like to implement starting this coming January. We recently conducted a survey among the parents and caregivers of our beneficiaries, our children who are registered at Firefly World. And as you know, we are the pediatric hospice, specifically in Georgia. It is until the age of 18. And with the current developments, how it works in Georgia, we have the children's hospice and then we have the adults hospice. But in adults hospice, a lot of the services you can receive after you reach the retirement age. So to say very roughly, after youth reaches 18, they are kind of on the streets and on their own, which we got another proof. We knew it, but another proof was the survey among our parents. And all of them, 100% of them, as their number one worry, indicated to us that what happens after our children reach 18. We cannot do much against the regulations, but we have certain plans, and I think we will continue working with them, finding certain so-called loopholes. but I'm very confident we can offer to these children at least the home care service. So we will probably have on contract another doctor who is not a pediatrician. And with this doctor's recommendations, I believe that we can add to our services 18 plus to start with for the beneficiaries who are currently registered at our services, at our hospice, and then we'll see how it goes and what results it will bring. So this is one direction we would like to work for next year. The second direction will be for us expanding our services to the regions, because with our resources, unfortunately, we mostly can focus on beneficiaries in or around Tbilisi, and currently we're actively working with the big pediatric hospitals in the region, and we have very high hopes that we can reach some kind of agreement to have maybe our expertise represented in the regions to provide home care service as well, which requires, as you know, the list of the financial resources. So this will be our two directions, two small expansions, I would like to call this, and of course participating in different webinars and educational activities that will be offered by PASTE will also mean a lot in the future. Thank you.
Thank you, Irakli. And indeed, I think everybody in their heart is hoping for the peaceful outcome in Georgia. But no matter what, I think that on a personal level, we still start collaborate, and has been shown by the PASTE as well, that palliative care is a philosophy that unites us all. And despite ideologies and so on that is going on in the world, palliative care people stick together. So indeed the problems that you mention here are very well known also, for example, in Austria, where I worked, because they have very good palliative care services. But the question is, what happens when the children turn 18? Then this kind of services do not apply anymore, and it puts a very strong burden to parents, as well as those who have got used to taking care of these young adults. And so it also again confirms that you have reached a very high level in providing palliative care for children. And now when you think of home care, then what I have learned, for example, is to set very hard limits to the region or area that you are covering, even if it seems like heartless to do so, but to save your team and people who provide this work. Even in the beginning, you have to put very strict limitations. This is how they survive in Brasov, where they say 30 kilometers is the limit, otherwise we will not survive. And this I have seen also in studies done in Germany, in Bavaria, or and this is learning from others. So it seems like that how we can do everything, how we throw some people out, but always those who are on the border somehow, they also test your own limits and the limits of your team, and that's why it needs to be also, you need to be strict in that this, at least what we have learned. And so I don't know if it resonates with you as well. And there is from Jan a nice message in the chat also for you. So and because Jan is from Czech Republic and he has been working also in Georgia, so I hope that you can interlink also and you get good wishes from the Schwanis Children's Hospital, which Jan was involved there supporting it. So yeah. Are there some? Yes, go ahead.
Just one comment to Jan that yes, of course, thank you so much. And one of the brightest corners at our hospice at Firefly World, and who's been here, they probably can agree with me, is our therapy room that was actually provided and funded by Caritas Czech Republic. both for our beneficiaries and the staff as well as a peaceful space.
Yes, thank you so much. And now we will move further. We go now to Armenia, where we all have very fond memories. So thank you, Irakli. And we will go again to pediatric rehabilitation specialist Anush Sargsyan. Is going to tell. Hi, Anush. Nice to see you again. Please tell us about your work now that you are maybe paving the ground for, and what has happened this year. So please, floor is yours, and you can speak in Russian or English or Armenian, whatever.
I will speak in Russian. Hi,
Okay.
everyone.
Hi everyone, hi dear colleagues. I'm very happy to be here and to be part of PASTE. I was very happy when you made the decision that the summer school would take place in Yerevan. It was a very interesting school, very intense program, and I met the people of friends whom I already knew, and I met new people, and we are in communication. When I'm facing some challenges, quite often I text these people, and Yulia also knows about this. I text Anna Gorchikova. I really like to ask questions when I'm faced with some difficulties. So, in medicine and in palliative care, people are very important. And here it's very important to have contacts with other people that work in the same field, because this work is tough, it's challenging, and we need to be, in good shape to keep up and just make some small steps forward. So this year, the Ministry of Healthcare in our country decided that it will launch a pilot program for children. It's a mobile program, because for 3 years we've already had one center for palliative children, those who have cancer and don't have cancer, but we didn't have any home-based support and care. But it's very important, because when people and children leave this center, they don't get any support at home. And so this pilot program, I hope, will start in the beginning of the next year. It will cover 40 children, and the pilot period will be 6 months. It will be in Yerevan and 30 kilometers from Yerevan, around Yerevan. So, during this pilot program development, we drafted some documents, and I participated in this, how to select these children, how to add some survey data, and maybe 6 months later, after this pilot is finished, we will analyze what went well, what didn't, what we have to review and reconsider. But I also thought that we need to create the registry for pediatric palliative care patients, because this is how we're going to talk to the Minister of Healthcare. We can show these are the people, the children, these are the diagnoses, they need this, and we will also back it with some figures. I guess, well, it will be better to take care of these children at home rather than in hospitals. And also, I know that a lot of these children have some difficulties with their diet, nutrition. Quite often, parents don't want any assistive technologies when it comes to nutrition, and here we have a lot to do and to improve. And I would like to get some training how to nutritionally support these children, how to talk to their parents, where to get it from.
That would also be good to have some sort of joint research programs between the countries. For instance, in Latvia, they do some research program, and this could be possibly done in Armenia, possibly in Georgia, and later we could compare and see. what kind of data we receive, and would later understand how it can be of help. And I also would like to thank Paige. I think Paige is sharing fantastic news articles. We don't have enough time for all this, of course, but they are doing this job for us. They select the most important materials. We just need to find time to read, that's it. What else? I think that's it. That's it. Yeah. Next year, hopefully next year will be as productive and fruitful as this one. Thank you. Thank you to all of you.
Thank you so much, Anush, for this again an inspiring and somehow also showing that big steps have been taken forward. And when you are speaking about collecting data and to present what you have been doing, and this is exactly again something that has been shown to be very helpful. For example, if you know oh God, Greek last names are impossible for me to pronounce, but Aliki from Greece, for example, I don't know if some of you might know her. This is exactly how she started to explain why her services are important. She gathered the data, and with this data, she could argue that, see, we help so many people, it costs that much, and we save also. Maybe we don't have to say, I think it's wrong to say that specialist palliative care saves money, but at least because we are speaking about specialists who are delivering high quality care, but at least we can, it's certainly cheaper than intensive care unit, and it is also less traumatic for the children you support. I have a question for you. You work in oncology, hemato-oncology. Do you also have in your focus children with neurodegenerative conditions?
We only work with oncogematological children, but when we do bigger programs, this is not just children. We also do that for CP, for cerebral paralysis, neuropathy, neurodegenerative diseases, and oncological ones. Those are 4 groups so far that we work.
Yeah, it's so because I have been speaking in Estonia, we have also many children who with cancer receive a very good oncological care as well as palliative care, but those with other types of disease are kind of left with their caretakers who have no medical education, and these children spend a very long time at intensive care units, then they are in their care homes with a person who has no idea how to take care of them. When they get tired, when crisis comes, the children are back in the intensive care units. So it's a big challenge also in Estonia, how to deal with that. And so I hope that at some point also those who here want to develop children's palliative care services in Estonia can come and learn from you maybe. So yeah, so it's very nice to hear from that you have more, even a broader focus.
Yeah, just like in Estonia, it's the same thing for us, but hopefully during this pilot program, we can try to organize this and tell the ministry that this is also very important. And this will not be the end of the program, and this will be like a regular program, not only in Yerevan or 30 kilometers around, but, and not only 40 children, but more.
Yes, yeah, well, this is the limits that we have to set to ourselves. I think that we want to do more, but we can do as much as we can, only as much as we can. Yes, because you say it's a difficult thing. And as I said, it has been very lovely to be on this WhatsApp group where you get some information and lots of hearts sometimes. So indeed, it is nice to be involved in a group like this. And so let's take now. Thank you very much.
I apologize, Piret. I just want to interrupt you for a second. I would like to diverge a little bit from this scenario because we have a familiar face from Yerevan, Arshak Hovhannisyan, who you know and remember. Arshak, if you may speak right now, if the time allows you and the technical opportunity allows you, you can maybe share a few words about this mobile service, this launch of the mobile service. Maybe just share a few words, if that's okay. Yes, please. Hello, Arshak. Now you're a speaker. A few words will be more than enough. It will be very curious for us. Hello, everyone. I'm glad to have this meeting again. I'm glad that we have this first school in summer school in Armenia. And we learned so many good things from you and everyone and accepted a lot of good things. Our clinic is quite huge for adults, and it's so great to have this special program for children. We also want to do this mobile program for the adults. What we've started is with doing visits. This was very important for us. We've learned a lot from you, from our colleagues. This was very, very curious. What we're trying to do is trying to ensure that all patients have enough support and care. That's it for now.
Thank you so much.
Yeah, thank you. So, Piret, the floor is yours. I'm sorry for interrupting.
Ничего. Arshak, really nice to see you. One question, quick question. What is the most difficult thing currently for you? Because you are doing a pilot project and, then palliative care is always piloting something, but at some point, all those things have to become also like regular services. And you are now in this piloting process, but so what is the most difficult thing currently for you? If you would say that if someone could help me with that, what would that be?
Well, I think it's the mentality, honestly speaking. Home visits are so hard. We try to help. We try to, ensure support, but to teach us, the doctors, and to teach the patients and the family members that this is okay, that the patients should have proper palliative support. And this is not just, a lot of people still are used to accepting that you shouldn't get any painkillers, you shouldn't get any support,
So
etc.
it's educating people, educating the society, and educating the doctors. This is, I think, that we all try to do here. So thank you very much, and thank you for joining us. We will stay in Armenia because now we will have Nareen, and she will speak about Hovhannisyan is the last name, so like Estonian horror is, but anyway. And also from Nareen, I heard that she has some data that she would like to present. So she has also like this kind of research aspirations in her heart. And I hope that she will tell us a little bit more. So thank you, Nareen, and floor is yours.
Unfortunately, Nareen is without us. I'm sorry, she just mentioned that she wanted to connect, but she's not here with us, unfortunately.
Let's go then to Kyrgyzstan, and we have Milana Turgunalieva, who will speak about. She is the chair of the Association of Palliative Hospice Care in Kyrgyzstan, and it's It's really fascinating, of course, to hear what is happening in such a large country, because Armenia is quite tiny, and maybe you can move further with bigger steps. But if you have such a huge territory to cover, then I think that it sometimes you might feel out of breath as well. Milana?
Hello, dear colleague. I'm so glad to be here in this team. Thank you, dear moderators. Thank you for this huge country. Well, it depends what you compare with. It seems like sometimes for some countries we're small, but still, I appreciate the invitation. Glad to be in this team. Let me say, I'm generally very happy that I'm a part of palliative care community. This is a very kind and gentle community. In Kyrgyzstan, palliative care has been, let's say, it's been here 10 years maybe here. But the first good steps have only been started in 2023, 2024. After in 2023, we have reached the simplification of recipe provision, especially for strong painkillers. The barriers were lifted finally, especially for socially important drugs. And we believe that this was a great success, a great success that has happened in recent times. In 2024, we have received an article about palliative care. Only after this, we've started being very confident about the steps we're taking. So it happens that we have this experience already, especially for mobile services. When it comes to 17, 18, maybe 2019 was the time, yes. That was the time when they existed, but they were all supported by the donors. After the project was shut, the Ministry of Healthcare couldn't even continue that, couldn't catch up with that. So that was so painful and hurtful that after the closure of this project, the service was left unattended. So we decided that we should work based on the legal documents. We should reach out to the healthcare ministry, should have palliative care. And dear colleagues, last week, I'll tell you the truth, the last 2 weeks, we've been super lucky with the supporters. This association of hospice care, we've been heard. It's been the prime minister who heard us from the republic. He wants to meet us, and he understands how important this is. So 2 days ago, together with the association, we've been at a meeting at the Ministry of Healthcare, and the first task for us is to improve the accessibility of opioid analgesics and integrate palliative care into sponsored programs, especially for mountainous regions. We tried to do this pilot project in these mountainous areas, hopefully for mobile services, wards, palliative patients. We hope to monitor the availability of patients. And we were promised that based on this pilot project, later we'll spread it out to other regions. So from you, it would be great to get some consultative support. Your priceless experience in the country. Thank you, Kira, very much, Irina, Kira. Please receive my gratitude. But we'll be in touch with you, and I hope I will keep bugging you with this question. And how was that with you? How can you give us a piece of advice? So thank you, colleagues. I'm sorry I took too long time, but if you have questions, I'll be happy.
Thank you, Milana. And indeed, I now have to admit that if I haven't visited the country yet, so that means that you have to invite me to Kyrgyzstan so that I can place it on the map and understand that it's not Kazakhstan, you know, because I was thinking of Kazakhstan. It was like, oh my God, but then if we think about your landscape, I understand that your landscape, because we have been thinking when I was working in Austria, that how mountains, for example, can be like a barrier for providing palliative care, so that at one side of the mountains you can have very good services, but that when you happen to be on the wrong side of mountains, then it's sort of like a geographical barrier. So I suppose that this is something that is happening in your region, and we. Because we have been operating with this question of rural and urban, and it looks like also that in the regions we are speaking about, we start to have this kind of huge discrepancy between the urban palliative care services. If you happen to live in the heart of Yerevan, then you get like palliative care services. But when you live in a countryside, then yeah, God knows what will happen with you. And I'm sure that in Kyrgyzstan you partially have also this. But I see you are smiling, so you're hoping that this new pilot again, which needs great championship from you and people like you, will really turn into a long-term surviving service, really. And I think that this is when we say yes to life and to those pilot projects, that we also have to immediately start to think how to make them long lasting and preserving, because it's very frustrating to see that you start to build up something and then it's torn down because of people just don't share your vision, or yeah, just lack of money seems to be mostly the case. Yeah, so also from you, you already said that you're looking hopeful in the future, but if you would have one wish free, what would be your wish, like for the next year maybe?
Well, as to the development of palliative care and cooperation with you, I'm as a co-chair of the Association of Palliative and Hospice Care. I would really like to have very good communication with doctors, our doctors that work with our patients. I will forward them to your webinars. I'm really interested in further cooperation to solve some issues when it comes to the organization, right? Because we have some and face some questions where your experience could be of great help. Thank you very much, dear moderator. I'm inviting you to our sunny Kyrgyzstan. We'd be very happy to see you and all of you, dear colleagues. Thank you.
Спасибо.
Thank you very much. Thank you very much for this kind invitation. In Estonia, currently, I can only offer lots of snow, but and ice. So some sun would be really nice. Thank you very much. And I hope that Roman and Ira and others, you wrote down what kind of support is needed, and we can really look into it, how to provide best support, and maybe a powerful summer school meeting in Kyrgyzstan would be something that Kyrgyzstan needs also from based and lifts Kyrgyzstan up. So just a wild thought here. Yes. All right. So we have some more lovely speakers. So thank you, Milana, once more. And immediately when my phone collaborates with me, I will, of course, Latvia is the farthest country from Estonia. And I'm really happy that Yulia Sirule-Galuza from Latvia, who has been doing such an important work in Latvia, and it's really shows also, and we are in Estonia are very jealous that this is happening in Latvia, and we are so much more behind, but that's normal between neighbors. So we met also with Julia at the European Commission's meeting in Brussels in October, on the 7th and 8th of October, and also it's lovely to see that European Commission is now making a political effort actually to invest into innovative palliative care services. So it's of course European Union, but many countries here are also interlinked with aspirations of European Union. But it's there has been lots of funding or quite a fair amount of funding for palliative care services related research from European Union, but now they are looking also into the impact and how this research is integrated, and obviously it shows also that in some countries they are very successful with those projects, and other countries also within the European Union lag behind, and that's why I don't know. Julia, how do you feel in Latvia? Are you one of those countries that lead the scene, or are you somewhere in the middle? And what maybe also inspires you to work more with PASTE than with you probably work both sides, also the Western European countries. So Julia, please, floor is yours.
Thank you, Piret, for your words. But really, we are in the feeling of wind of changes now, because the palliative care for adults grows and develops, and of course they have a lot to do else, and it is not so easy because it's the first time in our history when we have more of providers of help, more than one. And then we have a little bit of different thoughts how to do better and how to cooperate, how to communicate. And always money is too short to give to everybody. So there are a situation of concurrence also, and it is not such a good thing for palliative care. And in the children palliative care, again, we began to make the field a little bit more systematic, because for all the times we had very good experience in some parts of Latvia, mostly Riga, Liepaja, but not ours. And for now, very big process in front of us is to make the help really available in different parts of Latvia. And for now, just today, I received the invitation from ministry to one conversation together with a Riga specialist, how to make this better and how to make it with the support of the state. And I understand that it is a plan to make some kind of pilot project for better organization of children palliative care also in regions. And so we are in front of changes, and I really need all experience what I have to help to my country to do it, because I am a practical worker. I never was a systemic person. So for me, it is a very new experience. And I know that for now, people who are working systemically all the time, but were not so very successful in the development of the field, they need practical advices. So I hope that the next year we will be in a different position and it will be better for everybody. And the cooperation on the world level is very necessary for it. Thank you.
Yeah, thank you, Yulia. It's really true that it needs this kind of strategic evidence-based planning as well as practical work, and this all those people need to find a common language. But for you, I think that you got to know Minna Hökka from Finland, and Minna has been such a force majeure in Finland, and now they have had the project and funding for 3 years, I think, from government, how to patch up the gaps in the service provision. So I would definitely suggest to talk to Minna, get together with Minna, because she has been really looking in her region, in which is huge, up there in Finland, how to if you have in service provision weaknesses, because if you have different services you always have gaps as well, how to bridge those gaps and what is needed so that there are no gaps anymore. And we have in this group people with such a know-how. Of course, Finland has been very systematic in providing money also, but Minna is the person to talk to in this regard, because she really is doing this work in Finland right now. So I think that it is helpful, and she is very practical person as well as research person. So I think that we can look up to Finland and see how this work is being done there very nicely, very systematically. I just was 2 weeks ago in Finland, where they have 2 palliative care organizations, but it was for palliative care physicians, and they have to remind themselves also that in 10 years, thanks to government funding, they have made immense changes in provision of palliative care services, because they understood what are their country's needs. Then they implemented palliative care education for nurses and physicians in all schools everywhere. They taught the teachers as well, and now then they built up the services, and now they are filling the gaps. So the work has been very systematic, and I think that take your Latvian delegation to Finland, to Minna, and I think that you can learn a great deal how this is done. Yes.
Yes, I definitely will ask about possibility. Yes.
Yeah. So, but if you now would have, like, I think from your face, I saw a great concern, like for Latvia. But if you would have like one wish for free, so, or if you could ask based or whoever, God in the skies, like, or a Santa Claus maybe. So, what would be your wish for the next year?
My wish for the next year is the development of clear cooperation of all professionals, because our big plan for Latvia for next year is to make an alliance of palliative care where everybody can come together and discuss and plan and develop the field as friends and colleagues, and good colleagues, and not as concurrents. So I think that the community communication, cooperation is the main things in palliative care, and we need more of this.
I support you with that, and working friendly together and not creating barriers because there is some money to share is not a good thing. Yes, thank you. And I really hope that you will find solutions and get inspired then by countries who have maybe already learned their lesson. So yeah, thank you. And now we have our final speaker. And this is now from Kazakhstan finally, so I'm not getting the countries. I am getting the countries right. And it's really a pleasure to have Gulnara Kunirova with us, because she is also this kind of force in Kazakhstan who is doing so much work already for many years. She's working with WHO, and here now comes, and she's also the president of Kazakhstan Association of Palliative Care, and yes, it's not an easy job, I would say. So I'm not jealous of you, Gulnara, of the work that you are doing. But please tell us how the things have been going for you, and what are you looking forward in coming years, maybe, or at least one thing for the next year. The floor is yours.
Hi, Piret. Thank you very much. I have no complaints, by the way. It's a good job once something is being accomplished. I'll continue in Russian if you don't mind.
So first, I would like to thank Paste for today's webinar, for the work that you are doing. All the resources that are created and established are very important and very useful, such as the digest, as well as your webinars and some other grant opportunities, for example. I wish you to continue developing those opportunities.
I just want to point out your exemplary, the most sensitive approach. And such a care about every single aspect of work, from design, the website, the design of any event, from the tone of voice that you choose. You recognize that this is so important. Paste has become, I don't want to, lower down the role of other organizations. They're all important, they're all very necessary. But Paste has become a real wind of change. In our language, we have the word samal, which is a wind after the end of a hot day that it waves from the mountains. It's chilly, and Paste has become this evening breeze, let's put it. It's very refreshing. And I'm so grateful to the team for that and for the fact that you step by step, create this community, unite all the people. You're doing this with great care, very much appreciated. I so much appreciate the colleagues who have been actively participating, our Armenian colleagues as well, for the fact that you've hosted us. You've hosted such a wonderful event. The comments and feedback was so warm. And this is one of the events that, it pushes us to change. It pushes us to introduce something new. And at any significant event, there is always this reflection. You compare yourself to what the other colleagues are doing. You're reflecting upon this. Maybe you praise yourself for what you've done. Maybe you see some of the failures. You can copy something from your colleagues. These are so important things. Apart from, of course, the information that we receive during this communication. When it comes to this past period, I can say that perhaps for us in Kazakhstan, 2023 it was very special for a bigger number of people who got involved in the palliative care movement. We had new members in the association. Maybe these people were a bit apart, a bit aside, observing. Now they now want to participate more in creating the norms, in working with the legislation. They want to share experience. They become more open, more cooperative. This is very important for us. We conduct this conference regularly, our association, in the end of the year. This year, we've decided to not do it somewhere in some central part. We've organized it in the northwest, in small city of Aktobe. There was this huge movement they've started a mobile service for oncological patients. These mobile services existed. They were launched in 2018. They were just a small project as a part of a charity foundation pilot project. Then they were introduced in oncological service. They have become an obligatory part, an inherent part for the oncological patients. And we figured out that during this year, we now have 214 mobile services. And when we started understanding that, it was not exactly what we should be super happy about, because we have a very big country. As Piret mentioned, yes, that's true. 50% of the population live in the city, 50 live in the village, because the territory is so huge and the density of the population is very low. And so it's unclear how we can organize the mobile services for them. But how can we do that in the village? It's not clear. So we start reviewing those approaches. It turns out that we need only 77 mobile services across the whole country. We don't need that many. We just need to be efficient. We just need to be very narrow and niche and work very specifically in every region. To have a model in every region, let's put it this way. Next year, we hope to see a lot of changes in the legislation, because we will have some changes in our main law, healthcare protection law. And there we've introduced some changes when it comes to palliative care. And despite the fact that as lines, they look very basic, of course. But for example, we deleted the wording in case we don't have enough of evidence for radical treatment. You see, we are broadening the phrase. This is not just support for the people who are dying. This is an opportunity for the introduction of early palliative care. And we hope that this will work well. We've gone through several stages. Now the parliament members will be making. And now we're introducing some amendments and changes in the standard of palliative care. And there we want to broaden the categories. Patients who will be covered by palliative care. There we'll have some specialization. Preliminary palliative care, specialized palliative care, because we feel the need in that. And of course, we plan a lot of changes, especially in the infrastructure. We're going to build a new hospice in Almaty. The existing hospice is already quite big, 100 beds. We'll have a new building with a new standard. It's a great new building. And we're expecting big changes in terms of children palliative care. Because if adult palliative, it's already at some stage of development. Children palliative care doesn't have anything. It's just the starting stage. But now we have a position, the Ministry of Health, head specialist, children palliative care. And now it's a separate standard for palliative care for children. We've divided those standards into two parts, because the starting conditions were very different. Next year, we hope to host yet another conference separately, as we've divided these conferences for children and adults. Same story for next year. And there is a plan to organize some nice education program. And hopefully for that, we cooperate with the National Institution of Pediatrics and Children's Surgery. There are so many plans for next year. And if our plans can cross over the plans of peace or colleagues of other countries, we'll only be happy. Thank you very much.
Thank you so much, Gulnara. It's always nice to hear that actually you have nothing bad to report, that things are going nicely, even though you acknowledge the challenges in your country. And again, in terms of this service provision, I think that Finland is one country to look at. Because they, for example, say that in wintertime, things that are like frozen lakes, for example, in wintertime, are ways that are improving the access to healthcare services. But during the summer, you have to, drive the other route to reach your patients, for example, when you provide home care services. And they have done a very thorough analysis of how to operate, like if winter time provides other opportunities than summertime to reach. So maybe you can learn from that experience also when you start to reorganize your home services. But we have another speaker, so from Kazakhstan, and I am looking at the time as well. And so I would like also Yulia Streletskaya, who is anesthesiologist and anesthesiologist and the head of respiratory support, palliative care and rehabilitation center, to speak about a little bit her work, and so that then we can wrap up this nice how things are going conversation. Julia, please.
Well, I've been working in palliative care quite recently, starting from December last year. And the neuro muscle patient quite specific, but in spring this year, I got to know Gulnara. We didn't know each other before. And together we collaborated and we've done a fantastic project that I'm so proud of. This is our first Kazakhstan conference in palliative care that was organized in October. And this was a great breakthrough in terms of information support about the modern trend in palliative care for the children. We had a fantastic number of amazing speakers, and I'm so happy we had foreign guests. And foremost, showed to us that children palliative care that is still there in the country. It is uniting people who are not alone. There are some like-minded people around you who can do the same thing as you do. You didn't even know that before, probably, but now you understand you're part of this community. We hope we can continue. We've been selecting the conference for so long and finally decided to make it a open every day. And I hope this can become a great tradition. We hope we can have this same conference, second time, third time, etc. For myself personally, I have taken upon a motto: you can always do it better. You can't always radically change the situation, but you can always make it better. This is my personal motto that I'm standing with, especially when we try to assist children in our country. And we can continue this development and all about information support, consultative support, collaboration and cooperation. And we've already collaborated with Rustam from Uzbekistan to do some educational content. Hopefully we can do that in the next year as well. So I think that seems to be it for now. That's all for the plans.
Thank you very much, Julia. So it is nice to, sometimes you have to go outside of your country to get to know people inside your country, isn't it? So that's why also traveling is such an enriching experience. So it's really nice, and I hope that also the little scholarship that you received from PACE then has lifted you up a little bit, and you have got some inspiration also with this experience. So and of course it is nice to hear that you start with the conferences, and I'm sure that there at one point we will celebrate the 30th of conference of children's palliative care in Kazakhstan, and we are asking ourselves that where did all the years go? So I am sure. So really, thank you, and thank you for all the participants who now reported, and thank you also, Roman, that you are giving me strict instructions on my mobile phone that I did not read how to moderate this session. So I am not very easy to rein, I think. Yes. So, but I hope that. It has been a nice moment now before the year ends for you, and you have heard another batch of inspirational stories. And if I may wish you something, then take care of yourself, because you are so much needed in this world. So, and if you need help, then we are there for you. I am there for you, and so let's keep supporting each other, really, and thank you for all your work. Now, Roman, I think you have now. Yes.
Thank you, Piret. Of course, the instructions that I was sending is not because I don't trust you, but because we really wanted this to be as time efficient as possible, and it worked very well. It worked much better than we thought. Thanks to you, of course, dear colleagues. We do need to complete because we promised to finish in time. And thank you very much for all your stories. It's true, it's really inspiring. It seems like my computer screen is going to burst now because I have such a flow of energy and all of these emotions, and that's all because of you. Thank you so much. I want to say once again, big thanks to those who are our listeners. I can see their names: David, Mina, everyone, Rodami from Georgia. I think that's you. I hope I recognize you. And of course, everyone, greetings. Now, what you'll see in the chat, the links to our information resources, our social networks, website. There you can subscribe to our newsletter. And now we have a new feature in Zoom. After we finish, you have a feedback form. If you can complete this feedback form within just 1 minute after the end of the workshop, that would be fantastic. Of course, I want to thank our interpreters, Anna and Chris. Thanks once again for your amazing work with us. And thank you for the great conversation. I'm sure we're going to re-listen and talk to each other about what we've heard. Let's try to get in line with each other, with you and your needs. Hope it will be helpful for all of you. Wish you all the best in the upcoming year, and thank you very much, Piret, for the moderation. This was a great team. And time to say Happy New Year, Happy Holidays. We say it's all around the corner. I'm sure time will fly and there will be some champagne and firework and whatever you have for your celebration. Hopefully this year will be nice, quiet, peaceful, and happy for all of us. And as Piret said, take care, please, because we do need each other, don't we? Thanks a lot. Have a lovely holiday season.